My name is Dr. Alice Epitropoulos. I'm going to review the steps of cataract surgery, which is one of the most common procedures performed in the United States today. It is also one of the safest and most effective surgeries with a success rate of about 98-99%. Small incision phacoemulsification is the most frequent and contemporary method used in cataract surgery. Two small incisions are made at the edges of the cornea to gain access to the inside of the eye. Next, I place a viscoelastic solution, a special gel, used to keep the eye formed and to protect the inner lining of the cornea. One of the most critical parts of this surgery is known as the capsulorhexis. A circular tear is made on the front part of the capsule. The capsule is a thin cellophane membrane or bag that surrounds the cataract. This capsulorhexis gives me access to the cataract. A cataract is a clouding of the eye's lens located behind the pupil and can cause vision problems such as driving and problems with reading. The most common type is related to aging. Next, what I'm doing is called hydrodissection, which creates a fluid wave around the lens, which frees up the nucleus or the dense inner layer of the cataract from the cortex, the outer fluffy layer of the cataract. It's important to make sure that the nucleus rotates freely back and forth, which makes it easier for the ultrasound to remove. I use a pre-chopping technique which allows me to split the cataract into smaller fragments, therefore reducing the amount of ultrasound energy in the eye. Less energy results in a safer and more efficient procedure with speedier visual recovery. Next, we use the phaco tip, which is the ultrasound device to break up the lens into even tinier pieces and then vacuum from the eye. The tip moves at ultrasonic speed. This device also irrigates fluid, which keeps the eye formed along with the viscoelastic gel. The second instrument guides the fragments into the tip and protects the delicate capsule. We do everything that we can to keep the capsule intact since it houses and supports the implant. This is the last piece of nucleus that is being removed. Next, we remove the fluffy cortical material that is left remaining in the eye. We use a silicone sleeve, which helps to protect this thin capsule from tearing. Cataracts in their early stages, vision may improve by using different eyeglasses, magnifying lenses, or stronger lighting. If these measures don't help, surgery is the only effective treatment. A cataract needs to be removed only when vision loss interferes with your everyday activities, such as driving, reading, or watching television. Most of the cataract is gone except for a small piece of cortical material, which is removed using the irrigation aspiration instrument. Additional viscoelastic is instilled to prepare for the implant. The implant is folded like a taco and injected through our tiny incision into the capsular bag and slowly unfolds once it's in the eye. Today there are several types of implants that patients can choose from. Monofocal implants will correct one distance and still require glasses afterwards. A toric implant can help to reduce or eliminate astigmatism. And then lastly, a presbyopic implant provides a wide range of vision from near to far, reducing or eliminating the need for glasses. We remove the viscoelastic so it doesn't cause a pressure rise, and is replaced with balanced salt solution, or BSS, which is basically like a sterile saline. Most of the time, the incision is small enough and self-sealing that stitches are not required. Thank you for your attention.